Okay, so I'm Jessica Intravia. I'm one of the hand surgeons. Today I'm with Eric, and we're going to do the hand exam, basically. So if someone's coming in with hand pain, first you want to check to make sure their range of motion. They can do full elbow extension. They can do full elbow flexion, so their fingers can touch their shoulders. If their elbows are at the side, they should have full supination with their palms facing the ceiling, and they should be able to turn their palms fully with the hands facing the floor. You want to be careful. Sometimes people will cheat by moving their elbow. They can get more pronation, even though they don't have full pronation on exam. Next, you're going to take a look at the thumb. So key landmarks to palpate if someone is after an injury is the scaphoid. You can feel that in two spots. One is the anatomic stuff box, which is right here. And the other part that you feel the scaphoid is the volar tubercle, which is kind of right here on the base of the thumb. Okay. Other things you can do is a CMC grind test. This is looking more for arthritis in the base of the thumb. You take the first metacarpal, you hold it, and you kind of press down and go in a circle and see if that causes pain. People with CMC arthritis will also have a kind of a hump right here, and that'll hurt when you press on it. These are more people over the age of 50 that you're worried about the arthritis in. The next thing you want to look for is dequervains. So if you put your thumb inside, make a fist around, and you stretch down to the floor, it's called the Finkelstein's maneuver. This will cause pain for someone with dequervains tendonitis. And as you remember, dequervains tendonitis is the tendonitis of the first dorsal compartment. The second way to check for dequervains is the hitchhiker sign. So someone gives you a big thumbs up, and you press right here. That can also cause some pain in dequervains. The other things for dequervains to look at is sometimes people will get a bump right here or even a cyst. And sometimes they even get clicking when they move their thumb up and down. It can all be symptoms of dequervains. So next, moving on, is you're looking at the palm of the hand. You want to check each pressing over the A1 pulley and bending and straightening the finger to check for any trigger digits in any of the fingers. So for a trigger digit, people are going to have some pain over the A1 pulley, which is right here. If you look at the distal palmar crease, it's just distal to that is where that pulley is. You press firmly, and also with some passive flexion of the extension, you can feel the tendons moving and sometimes even a nodule going back and forth. Other complaints of trigger fingers is they may click or get stuck in a bent or straight position. The other thing is to look to make sure people can do a full fist, so you can make a full fist in. His thumb can touch all the way to the base of the small finger. And then other kind of wrist maneuvers to looking at are palpating the dorsal wrist structures. So you can palpate the scapholunate ligament, which is right about here, or the lunary triquetral ligament. Both of those can be injured in a sports type injury. In general, there you want to palpate the distal radius is over here, or each of the metacarpals within the hand. The other common complaint in the hand world is ulnar-sided wrist pain. So on the ulnar-sided wrist pain, there's a couple different things to palpate. You can see the ECU tendon moving right here. Its insertion on the base of the fifth metacarpal. That sometimes is a point of tenderness for people. The other options is if you get inside the fovea itself. So you can see the ulnar side of the hand, there's a little space there. That's the ulnar fovea. That's where the TFCC is. You can do ulnar impingement when you kind of press on the fovea and rotate over. That'll give a little bit of an ulnar impingement sign. Other options is the pisiform right here. You can palpate that. People can have pisotriquetral arthritis or sometimes just some pain on the pisiform. There's a test called the ulnar boost test for the elbow, just like that. So when you press up the pisiform and hold it steady, it actually gives security to the wrist. This is people with ulnar extrinsic tears sometimes have that. And then the other ones for just general traumas, you also want to palpate the hamate because sometimes people can get hook of hamate fractures or pain there. Finally, with kind of the elbow and wrist exam is the volar wrist. You have all the tendons, so some people get FCR tendonitis. You can palpate right there at the insertion of the FCR. People also get FCU tendonitis. You can palpate at the insertion of the FCU. There'll be tendon there, or tender there. The other thing is carpal tunnel syndrome. Not as much in an injury type scenario, but a very common complaint. You can tunnel, so you can do tapping over where the nerves are, with the median nerve here, the ulnar nerve here, ulnar nerve at Guyon's canal over here. That can cause some pain with the tapping or increased symptoms. The other is the Durkins test. So if you put pressure over the carpal tunnel and flex the wrist, hold it there, This is one of the more sensitive tests for carpal tunnel. It'll cause recreation of the symptoms or numbness and tingling in the radial 3 digits. And finally, you can also, if you're looking at nerves, you can look at cubital tunnel. So with elbow compression test, is flexion of the elbow and pressure over the medial elbow right next to the medial epicondyle. That's the cubital tunnel. This also can recreate numbness in the ulnar digits for cubital tunnel. So here's a quick example of the hand and wrist exam. And if you have any other questions, I'm happy to answer them.